Hello, ladies and gentlemen. Welcome to episode 2 of PGIM India Mutual Fund presents LiveMint Amend, Adjust and Adapt. This is a series of high-powered discussions and analysis where we're trying to look at various success mantras in what is likely to be the new normal in the post-COVID world. Now, I'm Vikram Chandra, founder of Heritage. Today, we're going to be looking at the topic of health and well-being. And obviously, in the middle of coronavirus, I think all of us are thinking about our health a lot more than we ever really want to be doing. But first, let's just hear from one of the people who's been leading the battle against the coronavirus in India, Dr. Randeep Guleria, Director AIMS. Sir, it's a pleasure to have you with us and just wanted to get your sense of how we are actually doing. Look, we know that the cases have risen a lot. Every day, it seems to be almost like a new record number of cases, but fatalities seem to be still well under control, I guess is the best way we can put it. What is your sense of how India is dealing with the coronavirus?
So I think as compared to countries in the West, we have done well. We must always remember that the cases will increase considering the size of our population. In absolute numbers, if we were to look at it in number of cases per million population, we still are pretty low. And I think we did a lot of things which were right to begin with. We had the lockdown very early, and that actually gave us time to prepare in terms of improving our healthcare infrastructure, whether it was really making COVID care centers, COVID hospitals, or COVID ICUs. At that point in time, we realized that one thing that is really going to make a big difference is having oxygen points. And a large part of India, this was something that was felt may not be there, especially in rural India or district hospitals. And a lot of attention was actually put forward in trying to provide good oxygen points and beds with oxygen 24/7 in these hospitals. We also then ramped up our ventilatory support. One of the challenges that we had in the early days, if you remember, was PPEs. There was a huge shortage of PPEs because of the fact that they were all being imported. They were all coming from China. And when you have a pandemic, there is always a demand from all countries across the globe for something which is coming from one area of the world. And gradually, I think we were able to get our Indian manufacturers on board. And now we have surplus of PPE. We are in a position of supporting PPEs. And the same goes true for testing. We started off with very little testing, very few labs, doing around 10,000 tests a day. Now we have more than 1,200 labs and we're doing more than 3.5 lakh tests a day. But still a lot more needs to be done, especially when we start looking at how the pandemic is behaving, going from metropolitan cities to smaller towns. And I think there is a lot of aggressive effort we need to do in terms of testing, in terms of containment, in terms of tracking, and especially in the tier 2 cities and in the rural part of our country. So we have done well, but there's a lot more to do.
Before I move on, I just have to ask you, I want to discuss, exercise and how people are staying fit and if they are staying fit in the middle of all this. But you mentioned immunity. So I've got to ask you, because I don't think for 120 days, a single day has gone by when somebody has not on WhatsApp sent me some message saying, ye khao tumhe coronavirus nahi hoga. And I don't know why, maybe I'm just skeptical by nature. Something tells me 95% of that is probably a hoax, right? Is that really something which you can do to ye khao and coronavirus nahi hoga? Maybe some of it is more true, eat healthy and zinc tablets or whatever.
Well, I just think it's like saying ke shadi kar lo to pyar ho jayega, it's one of those kind of things. You need to look at immunity as something that you do on a daily basis, and you are committed to leading a healthy lifestyle forever. That's how immunity or health or good shape, fitness, glowing skin, or whatever else that one is looking for is built. It doesn't come out of a bottle. It's not something that, now that it's the big hashtag topic of like immunity or immunity booster or whatever, that I'm going to open a zinc tablet, a calcium tablet, an omega-3 tablet, a vitamin C, and everything's going to get all right with me. I do know that chemists have run out of vitamin C stores, so vitamin C tablets. That's the kind of mad rush that we are having for just popping pills. But immunity is not something which comes out of a pill or a potion or an app or a product. It has to be something which is more commonsensical. Wake up on time, sleep on time, have a routine. Even if you're not going to office, eat at home and work out at least for 20-30 minutes every single day, even if it's just a couple of Surya Namaskars that you're doing daily. So, but common sense will not make it to a WhatsApp forward. It's poor for business. It's not something that one can sensationalize or talk about. So you're absolutely right in being a skeptic with all those WhatsApp forwards. You've got to go with your gut and common sense at all points of time.
Stick to the common sense and stick to all the good old things that people have been telling you all this time.
Yeah.
Guys, eat healthy. Dr. Parekh, I really wanted to get you in on this entire, on the mental health aspects of it. And, there are people who are still locked down for a very long period of time. They're facing stress. And some of the people who are locked down, for young kids, for example, it must be very, very challenging. How do you deal with it? You're dealing with school entirely remotely. And for the elderly who've not been able to step out. Are you seeing lots of accelerated and aggravated mental health issues during coronavirus?
Vikram, let's understand this. The fact is that we've experienced the most unprecedented aspect of our life, which we've never heard about, never talked about. We've probably read about it here and there, the Spanish flu, the bubonic plagues, and so on and so forth. But fact is, none of us was prepared. None of us is prepared. It continues to be an evolving situation. And uncertainty is very much a normal. So these are realities. And because there is no clear-cut timeline, there is an underlying stress. There is a fear of the illness and of the consequence. In that light, the fact that mental health concerns are there, increasing number of people are talking. I've taken, frankly, more corporate, school, public sector engagements in the last 100, 120 days than I've taken probably the last 2.5 years. Yeah. Because everybody wants to know what best they can do. And we have to accept it. Nobody has the right answer. We try in our sincerity to do what best we can. And I've been telling people there's only one way forward. Focus on one day at a time, Vikram, just one day at a time. Think about today, don't think about tomorrow. Yeah. And for today, you have to look at only 3 things: positivity, productivity, connectivity. You stay productive the best that you can do. Don't compare to pre-COVID days. Stay positive because that's in your control, and stay connected. If your support systems are with you, you'll come out of this comfortable.
But it is also possible that there will be some people right now who will be facing financial stress whom you wouldn't normally think you would or associate with financial stress. Restaurant owner, somebody who's got a small business, you think they're okay. They're middle class, they're maybe even upper middle class. Some of them may even be rich. And suddenly they are finding in these 3-4 months their business is shut down. They don't know how to pay their salaries. They have home loans to pay and all of that. So it is possible that the stress of that financial crisis is hitting people whom you normally wouldn't associate with financial problems.
Yes, that's absolutely true. And, anecdotally, as we speak to people within our office and extended friend circles, you do hear about that kind of a stress that people are being with, especially in small businesses, Vikram, as you mentioned earlier, that's been the toughest. Now, the insights that we've had, Vikram, here and for PGIM India, our parent Prudential Financial in the US have done various studies and have figured that this stress does impact, as Dr. Parekh said, it impacts productivity, it leads to absenteeism, it increases health costs. And therefore, having a control over this financial or getting to financial well-being from our perspective has been a couple of simple things. One, getting a control over managing your day-to-day finances, having the behaviors that you can adopt to manage your day-to-day finances, having a sense of achieving your goals, your financial goals, and 3, about protecting from financial risks. Just those 3 aspects that one needs to be sort of thinking about.